Hello, good morning. My name is Dr. Khadija Mbeneka Ali, a senior resident in obstetrics and gynecology, currently attached to gynecologic oncology at the Chandaria Cancer Center. So welcome back. I know I've been absent for quite some time, but I'm glad to be back with you. So today I want us to speak about cervical cancer screening, right? And first of all, I think most people will be asking, so what is cervix? Cervix is the mouth to the uterus, if I put it in layman's language. So there is the womb, the uterus. I'll attach pictures. And then the opening of the uterus is what we call the cervix. Sawa, that's clear? The opening of the uterus. What expands for the baby to come out? That is cervical, that is the cervix. So what are the risk factors for cervical cancer? First of all, you need to know that cervical cancer is the leading gynecological cancer in the country and the second most leading cancer generally in the country, and the number 2 killer in women among the gynecological cancers. Because so number 1 is ovarian cancer. It's not very common, but it's a killer. Then cervical cancer is a second killer. Okay, so what are the risk factors for cervical cancer? So anything that will predispose you to the human papilloma virus. Human papilloma virus is the virus that is what is directly associated with cervical cancer. So persistence, you can have human papilloma virus and then your body is strong enough to shed it off. But if you have persistence of the human papilloma virus, it can cause changes in the cervix that can lead to precancerous conditions first, then cancer. So precancer, kabla ya cancer, then a few years later cause you to have cervical cancer. So what are the risk factors for this human papilloma virus? Number 1, early age of sexual debut. So if you had started having sex way early, and when I speak of sex, it doesn't necessarily have to be penetrative sex. So way early, before the age of, very early, like 10, 11, 12, 13, that's an early sexual debut, etc. Like below the age of 18, very early. Number 2, multiple sexual partners. So you're predisposing yourself from getting HPV from everybody that you are with. And it doesn't necessarily have to be you only. Your partner also having multiple sexual partners outside could predispose you to cervical cancer, you as a woman. Then number 3, a very large number of lifetime sexual partners. So the more the lifetime sexual partners, the more the risk of having developed human papilloma virus. So if you've had like 2, 3, 4, 5 lifetime sexual partners, the risk is higher compared to a person who has only had 1 lifetime sexual partner. And then other things that could compromise your immunity, like smoking, alcohol consumption, etc., but especially smoking. Then being HIV positive or having anything that could predispose you to immunosuppression. So even having been, for example, a transplant patient and you have had to have immunosuppressants in your body that can predispose you to cervical cancer, or being a HIV positive patient. That's why for HIV positive patients, we screen them more frequently and follow them up more keenly as they come to the comprehensive HIV clinics. Speaking of HPV, remember the HPV vaccine that we have been singing about. Please take your 9, 10-year-old nieces, sisters, daughters for HPV vaccination, because if we prevent a person from getting HPV, we have almost protected them almost fully from getting cervical cancer in the future when they're big women, when they're older, when they're sexually active. I know it was rolled out in primary schools, public primary schools, but because of the corona issue, I think it has been stopped for some while because schools are closed. I'm not very sure where you can get it in the public right now. But if you can afford it, even privately, please get it done, right? I have a niece who is 9 years old, and I'm following up that issue. I want to get her vaccinated this year because she turns 10 in November. She must get vaccinated, yeah? So it's important to vaccinate your girls. I know in private it's a bit of money, but ask in your public hospitals, you could be surprised to find it free of charge. So for the government, it's free for 9-year-olds and 10-year-old girls, But if you're sexually naive, you have never had sex and you're older, you can also get it. And even if you've had sex, there's some protective effect. Okay, get it done. If the government can't provide for you, please look for money and pay for yourself. But mostly we recommend it for people who are sexually naive, who have never had sex. That's why we insist on the 9 to 10-year-old age, because after 10 years old, that's why we know people are starting to have sex in Kenya right now. The sexual debut in Kenya has gone down to around 10. You'll be surprised. So we've talked about HPV and the risk factors. So how do we do the cervical cancer screening? So we have two things. We have Pap Smear, what everybody knows. So Pap Smear is whereby we turn a brush into your cervix and collect some cells, take it to the pathologist for reading, cytologist actually, to say, okay, there are changes that could mean precancerous conditions of the cervix, or there's actually cervical cancer, right? But nowadays we have adopted an easier method that you don't even need a pathologist. It can be done anywhere, even in a tent, outside the church, outside the mosque, outside a chama. Very easy. We do what we call visual inspection with acetic acid. It's actually it's more of a screen and treat modality in the country. Very simple to do, and it catches so many cases. So, in other hospitals, I'm just talking about what I know and where I'm based. Okay, so what do you do? So I'll speak more about the VIA, the visual inspection with acetic acid. So what you do, you come to a room, like in the MTRH, you'll come to room 23, Chandaria Cancer Center. We'll put you on the bed in a lithotomy position, that is with your legs apart, like as if you're giving birth, yeah? And then we'll put this object called a speculum. Can be plastic, can be metallic, just to expand the vagina and be able to see the mouth of the uterus, to be able to see the cervix. Okay? Then I will dip my swab in acetic acid. Acetic acid is actually white vinegar. See, simple things. Vinegar, and it's a 5-minute procedure and you're out of there. So put it in vinegar, place it onto your cervix for 1 to 2 minutes, then remove my swab, then check with my eyes. If I see any white areas, what we call aceto-white regions, then I will know that there's a problem there. There's either some pathological change going on, even just infection, or there could be precancerous condition, or there could be cancer, right? If I see these white regions, then I'll take some biopsy. Biopsy ni nyama, chuna kidogo, not painful, no need of anesthesia. So you just pinch a bit and take it to the pathologist to read and tell us what it is. If it's normal, then I'll let you go. And we normally screen women. Okay, I'll talk about the age of screening. And then if it's normal, so I'll let you go. If it's abnormal, then I'll want to see how is it abnormal, and I'll follow you up according to the stage of abnormality that is found. If you're normal and you have 21 to 30 years, I'll tell you come after 3 years. I'll speak about the ages later. Right? So, very simple. 5 minutes, you're out of there. I'll just tell you it's normal, come after 3 years. If it's 2020, I'll tell you come 2023. Yeah? If it's abnormal, I'll pinch a bit, take it to the pathologist, get your results later. They tell you had CIN1, you had CIN2, you had CIN3, you had precancerous conditions. And the follow-ups for these different conditions is different. Like, for example, if you find that you have the very early precancerous condition, it could just be changes due to the human papillomavirus infection. So I'll tell you nothing to worry. Just, practice safe sexual practices, and then come after 6 months, we repeat. If after 6 months is still abnormal, then we'll see what to do, right? If it's CIN2 and 3, if it's confirmed to be like higher grades of precancerous conditions, then we'll want to treat you through different methods, one of them being LEAP, whereby we actually cut out the pathological part, right? So we remove the outer part of the cervix and the squamous column. I won't go into the medicine. I won't go into the medical jargons. So we'll just cut. It's an outpatient procedure, very simple, and your cervix will regenerate back to normal. The cut part will regenerate back, and you'll be good to go. You will have been protected from developing cervical cancer in the future. And then we'll screen you according to what we found and how we treated you. So what are the ages of screening? So the Kenyan guidelines say above 21 years, 21 and above in women who are sexually active, but this has been tailored now differently to different patients, because we have seen 16-year-olds, 17-year-olds, 18-year-olds with cervical cancer. So if you had your sexual debut very early, or if you're immunocompromised, I would want to screen you even at the age of 14, very early, right? Because if you're at 16 and you got cervical cancer, it means that you are probably having these changes even at the age of 13 or 14. So we will screen you we'll tailor the screening according to you, according to your HIV status, according to your age of sexual debut. But generally in the general population is from age 21 and above. So how frequently do we screen? 21 to age 30, we screen you every 3 years if all is well, just by doing the vinegar test, the VIA, right, or Pap Smear. Okay, if you are from age 30 and above, now from age 30, the current Kenyan guidelines say that you need to do a human papilloma virus test. I'm sure in the near future it will be rolled out and probably be free of charge. Probably, I'm not the government, I don't know. But if it's in the guidelines, then they will probably want to make it easy for patients, because it's a bit of an expensive test. So if you have your HPV test, it's negative, and you have your VIA and it's normal, then we'll tell you to come after 5 years if you're above age 30, right? But then if we do your test or your HPV test and your test and they're abnormal, then I'll want to see you according to what we found. So, and if you cannot afford HPV test, you can just do the usual screening and we book you every 3 years. But if you are doing it together with human papillomavirus test and all is well, then we'll want to see you every 5 years. If you're not doing HPV, it's every 3 years. It's more frequent. When do we stop cervical cancer screening? If you're at the age of 65 and you've been following your screening vizuri, following all instructions, you've never had any HPV positive test, you've never had any abnormal changes in your cervix, you do not smoke, you are not immunocompromised, then at the age of 65, I will stop screening. But then if you're at the age of 65 and you have had abnormal HPV tests, you have had cervical changes that are precancerous conditions, or you have been treated for the same. If you are a smoker, if you have not been following your screening frequencies as per Kenyan guidelines, then I would want to screen you for a further 20 years, so up to the age of 80 is 85, right? So I hope this is clear. I try to make it as simple as possible. I will do